Welcome to MedGate today, sir. Sir, can you please briefly introduce yourself to our audience?
Yeah, I'm Dr. Sanjeev Singh. I'm a medical director at Amrita Institute of Medical Sciences at Faridabad campus. And I'm a pediatrician by training, did my master's in hospital management and PhD in infectious diseases, and has been associated with Amrita for almost 25 years.
Sir, the first thing that I want to ask is what are the biggest advancements your hospital is currently investing in, and how will they improve patient care over the next 5 years?
As our hospital is, I'll talk to you about the various verticals. One is definitely clinical. There is a lot of work which is happening in clinical and our investment into clinical sciences. One is definitely technology. So, there is a lot of technology acquisition where we would ease out the the clinical work, bring it efficiency, make it more patient centric, and also reduce cost. A good example is we have just bought Lupix, which is a brain lab first in the Delhi NCR or northern India, which improves the navigation, imaging, and it is very, very good for neurosurgical and spine. Similarly, there's a lot of investment which is happening in the cytogenetics, molecular medicine, because that is where the diagnostic comes in. And we also have one engineering college within our healthcare campus, which is AI in medicine and data sciences. So there's a lot of work which is happening with AI, chatbots, and LLMs, NLPs with the clinical team, and which is sort of leading to some kind of an improve in efficiency and understanding. But then there is investment which is happening in clinical and technology and patient care uh, by improving the patient delight factor. The other investment which is happening is in academics. So there is a lot of online journals which needs to be available for a better publication. There needs to be a better teaching mechanisms. All students, undergraduates are getting trained into research methodology, robotics, artificial intelligence, which we are making it mandatory. Third investment which is happening in research. So there is a 7-story research block, and there are lots of basic equipment which is required for basic sciences, data sciences, environment science, and for clinical research. So there are huge investment which is happening in a good manufacturing practices lab establishment, and getting new equipments there with pharmacogenomics, pharmacology, with vaccine preparation, infectious diseases, maternal and child, new identifying new biomarkers, mass spectrometry, and things so on and so forth. So there's a lot of investment which is happening in various vertical, and possibly that is going to help.
Okay. So, sir, the next thing I will ask you is healthcare continues to face shortages of doctors and nursing staff. So, what are the strategies has your hospital adopted to address this challenge?
So that is a universal phenomena that's not restricted to any institution. Earlier there were 250, 300 institutions. Now there are 818 medical colleges. People are not available. So there is no way a institution can bring in any kind of a change and fill in that gap, because even there was only one All India Institute of Medical Sciences. There are 24 of them right now. The faculty strength is 50% even in All India Institute, which is an institute of national importance plus autonomous. So there is no way one institution can play any kind of a role to be able to fill that gap. The gap is phenomenal. So we have to get in 10 lakh beds. We have to get in close to 4 to 5 lakh of doctors to fill in those gaps, which is required as per the developed nation statistics. What we can contribute is having a medical college, which is 150 intake as an undergraduate, so they will contribute. We have asked for 50 more seats, so that will be 200 medical college, 200 undergraduates in the medical college. That's a huge contribution. Right now, we have close to 150 postgraduates. We'll keep on increasing the number of seats. That's the contribution which will happen. We started with 40 BSc nursing. We have reached up to 250 intake per year. That's a huge contribution. We allied health sciences courses for OT technician, dialysis technician, perfusionist assistants, and cath lab and all of it. So we run close to 18 courses. That's again a huge contribution towards meeting out these shortages. So I think that is what each institution should do,
Yes,
and
sir.
that is how we will be able to plug this gap.
Okay. So, patient expectations have changed dramatically. How is your hospital enhancing the overall patient experience while maintaining clinical excellence?
So fortunately, we are a not-for-profit organization. So that expectation is that we being commercial, and there is this gap between the public expectation and the financial bill, and that is how there is a bridge between, and that there is a mistrust, which doesn't exist, because whatever is being done is done for the best of the patient care. That's one. Second is, there are lots of devotees of ours who have dedicated their life, and they are only working as a seva, so as a selfless service, which doesn't exist in many of the institutions. They are a very, very strong foundation for us, because they meet with the patients and they try to fulfill most of their expectations which are there, if there are any. Third is that we continue to take outpatient, inpatient feedback electronically, so that that's easy, and we work on those feedback. We are trying to be having a good reviews and NPS score. Fourth is that we have a third party patient satisfaction review being done. So it's not just internally where you can manipulate. There's a third party who does it and then gives us a feedback that these are the scores and these are the areas of improvement. Fifth is we have a patient advisory council. So patients are part of this advisory council, where they come in and suggest. So they, being part of the patient, they know what went wrong or what were good, and they need to build on it. So it's a very independent mechanism, and we change these group of patients every 6 months, so that there are newer things which can be brought in. So we are trying a lot of things, so that the patient can speak for patient care and patient safety, and not just hospital and employees. So that's the change which we're bringing.
Okay, so sir, the last thing that I will ask you is, from a leadership perspective, what do you believe will be the biggest challenge for hospitals over the next decade?
So healthcare cost and the trust are the two biggest challenges which needs to be met, because healthcare cost is rising, and unfortunately there has not been major attempt to sort of restrict those numbers, and that leads to a commercialization and leads to a mistrust between the public and the healthcare providers. So that challenge can be met if there are transparency in the billing, if there are adequate measures which has to be taken to be able to cut down on those costs, and there is overall perception which is given to the public that it has all been done in the larger interest of their patient care. One thing which we have started is a utilization review. So our team of clinical nursing staff who sits in, and they look at appropriate stay, appropriate investigations, appropriate pharmaceuticals, and appropriate care, whether that has been provided, and we communicate that back to the clinical team. So not any additional investigations can be written as per which doesn't follow the evidence. Not any additional pharmaceuticals can be given which is not as per the evidence, and not any other, not even a single day of stay or a half day of stay should be measured, because it should be there, because that part is not being sort of addressed, and overall the care needs to be sort of supported. So healthcare cost needs to be reduced, and the trust with the patient and the family members have to be maintained, and that is one of the biggest challenge right now. Each leader should be trying their best, and I'm sure they are, to be able to address this.
Okay, thank you so much, sir, for joining MedGate today, and thank you so much for sharing your valuable time and insights with us.